Hi, welcome to What's Happening at Tri-City Medical Center. I am Kellie Davis, and I will be your host for this series made in collaboration with KOCT, North County's channel, and Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local hospital and to provide you with information for a healthy lifestyle. With us is Dr. Penvose-Yi, a board-certified OB-GYN affiliated with Tri-City Medical Center. Her experience spans both coasts and the Midwest. She relocated to San Diego to create her vision of a women's wellness center that values the patient as a whole. Her office services women throughout their life. She is here today to talk about women's health after menopause. Welcome, Dr. Penvose-Yi.
Thank you very much. Nice to be here.
Well, the first question is to ask, what is menopause? But I know from my grandmother's day, just kind of that they used to talk about going through the change. Is this the same thing we're talking about?
It is the same thing. There's a lot of definitions you can use, but the change is the perimenopause and then menopause and that transition that happens from the start of symptoms to the last period to hopefully, in most cases, the symptoms going away, but not in all cases.
So there's this this idea, or I don't know if I want to say wives' tale, I don't even know if that's politically correct to say that anymore, that back in the day they sort of attributed menopause with the change and going crazy.
Right, the hysteria that's associated with it.
Why was that?
Well, you know, menopause, part of menopause is you do, with your hormonal change, you can get emotional change. Sleep deprivation is one of those things, and sometimes it's just because we're getting up to go to the bathroom a million times a night. That's a new symptom that as our vaginal tissue dries up, that can happen too. Now, of course, you know, a lot of the famous doctors out there talk about the wisdom of menopause. Some of us kind of figure out what's important and what's not important too. So there's definitely pros and cons to it, but I agree with the wisdom of menopause, but we definitely have some things that we can help women to transition through it a little bit nicer.
Because in essence, with menopause, because we're talking about hormones and all of these things centered around this menopause, this change that you go through, that's chemical.
It's chemical,
stuff,
and our body is just a big machine, you know, that chemicals take care of managing. So when those chemicals change, it changes a lot of things in our body, you know, mind, physical, emotional, all sorts of things.
So you said, we talked about menopause, so what is this perimenopause?
So perimenopause is usually the years leading up to menopause. I always tell people the average age of menopause is approximately 51, 52. The perimenopause is the time around menopause, commonly up to 5 years before our actual last period happens. We might start having some of the symptoms that we attribute to menopause. We might have the hot flashes, the night sweats. We might have the associated mood swings. We might find that our bladder is a little more irritable. We might get up more often at nighttime to go to the bathroom. Pain with intercourse, drier vaginal tissues. All of those things can be associated with menopause.
And is it true, because this is something else I heard, and we hear this is why I'm so happy to have you on the show, doctor, because you hear all these things that go on with women and women issue. Is it true that if a woman has had a hysterectomy earlier on in her life for whatever medical reason, you know, whether she's in her 30s or even 20s, can they go through this menopause earlier than?
So they can. So, you know, part of the blood supply to our ovaries comes through the uterus. So hysterectomy or even tying your tubes can cause your menopause to happen a little bit earlier. It's shown to happen. So a year or two earlier, when we give women a hysterectomy, that's what we usually tell them. You might get your menopause a year or two earlier than you were going to get it.
So some of the symptoms that you talked about was, you know, the hot flashes. That's what seems to be quite simple. They show it in all the movies. It's the time.
Right. I had it this morning. So yeah, the whoo, you know, and you're just sitting there, and out of the blue, the heat comes and hits you. So that, and there's a lot of women who can relate to that.
How would you know? I guess it's simply that you'd have to go to a healthcare professional like yourself.
How do you know it's a hot flash for sure?
That you're going through this thing,
right?
This change.
So you want to talk about it with your doctors. You want to talk to them about all the symptoms you're having. Of course, you can Google it and look online, but it's nice to have someone to talk to and see like, boy, do you think that this is part of it? I mean, we can have the menstrual irregularity, but some women don't get that. Some women have their periods right up to their last period, but they also have hot flashes and night sweats and all those things happening on the way to that last period.
Okay. So besides menstrual cycle changes, what are some of those other signs?
And we've kind of alluded to them.
Yeah.
The hot flashes, the night sweats, or just getting warmer. You might notice that, okay, I used to be able to wear this, but now I can't wear this anymore because I get hot when I'm wearing it. You might notice that you're more uncomfortable down below, a little itchy, or when you have intercourse, it's drier, it's more painful. Some people almost stop having intercourse altogether because of the vaginal dryness symptoms. You know, the hysteria, our mood changes. We're tired, sometimes we're getting up more at night to go to the bathroom. Just the hormones alone can change our moods, and kind of, we can look at it as clarity or we can look at it as hysteria. I'm going for clarity.
Okay. And do these symptoms continue after menopause? And I guess more importantly, when does it end, and when do we know that it ends, maybe?
So I like to counsel my patient, menopause is your last period. Postmenopause is 12 months after your last period. So if you've gone a full 12 months without a period, you are officially menopausal. It is not normal to bleed past that point. You need to see a doctor if you are bleeding 12 months past your last period. That is one thing that's really important to know for cancer prevention. But some women may have symptoms leading up to menopause, and they have last period, they feel better, or those symptoms may carry on past that last period. Unfortunately, for some of us, those symptoms can last a lifetime almost. Diet and exercise are definitely an important first-line therapy to optimize your healthy diet and exercise regimen. But then we talk about all the treatments like hormonal treatments, non-hormonal treatments to deal with the hot flash, the night sweats, decreased sex drive. There's topical hormone therapies for vaginal dryness. We now have new laser therapy for vaginal dryness for those women who can't have the hormones, or the hormones don't work for them, or they can't afford the hormones. Trying to think what else we talked about.
Well, along these same lines, I'm a former athlete, and I remember when I was younger, some of the distance runners, for example, they wouldn't get their periods. Obviously, they're not in danger.
They had such a lean body mass. Exactly.
And as a woman, I find when you talk to other women, we have our cycles change, and we're not sure what this is or what that is.
Right.
How is it just you have to get a good healthcare professional? I mean, how do you know when you're really, this is...
So and so we're gonna have menstrual changes around menopause. When do we need to worry about them? We need to worry about them if our periods are coming more frequently. So if every month we're having 2 periods, we need to worry. If we skip a period here and there, and we know we're in our mid to late 40s and we're around that time, an occasional skip period, and we know we're not pregnant, that's okay. But if we're having frequent periods, or if we're spotting all the time, bleeding after intercourse, those are reasons to see your healthcare provider before your routine well-woman exam.
We have about a minute, I believe. Vaginal atrophy.
Right.
What is that?
So vaginal atrophy is when our vaginal tissue, whether it's postpartum, breastfeeding, birth control pill, postmenopausal, loses its vaginal estrogen, it loses its hydration, it loses its elasticity. That can cause bladder symptoms, that can cause pain with intercourse, that can just cause general irritation.
Okay.
And so in the past, we've had traditional treatments are vaginal estrogen and over-the-counter lubricants, which work for some people, but not for all people. I was really excited to find that there's a new laser treatment out called the Mona Lisa Touch Vaginal Laser. I got very excited. I describe myself as a bread and butter OB-GYN. I don't usually get excited by all this fancy stuff, but when they came to me with this, I got very excited because there's a lot of women out there who either don't respond to the vaginal estrogens, don't tolerate the vaginal estrogens, can't have the vaginal estrogens. So now we're lucky enough to have the Mona Lisa Touch, and it is good for your bladder, it's good for your sex life, it's good for the vaginal dryness and your overall vaginal health. And we want to stay on top of our vaginal health. We want to talk to our doctors about it every year when we go see them. We want to keep that tissue healthy and not let it get into such a state of disrepair that it's hard to reverse the changes that have happened.